A very good evening, ladies and gentlemen. Thank you for joining us once again as we come back for our regular edition of Cancer and I am Dr. Muralidharan with the National Cancer Society of Malaysia, and Cancer and I is our monthly session which is targeted towards the public, speaking about different types of cancers and how we manage them. And more importantly, how do we stay abreast of them? And this is really a session tailored for you, the member of the general public. This evening, we're very fortunate and privileged to have with us an eminent physician and a consultant hematologist. Could I introduce kindly Dr. Nur Adila binti Anwar, consultant hematologist and physician with University Malaya Medical Center. Good evening, doctor. Thank you so much for joining us.
Thank you for inviting me.
It's always a pleasure to have you, and especially this month is September. And in September, it's actually traditionally Childhood Cancer Month. And it's kind of a bit interesting that we choose to speak about lymphoma today. And our topic is taking note of lymphoma. And because a lot of these hematological cancers not only affect children, as is commonly kind of believed, but also a lot of young adults as well, and doctor.
Yeah.
Yep. And
So
as we want to kick off this evening, doctor, I actually would really this is a question I think I also ask all our guests as they come on in every session. Why hematology? How come?
why hematology? I think that's actually my interest start off with my background actually is more in infectious disease rather than hematology. But throughout my master journey in internal medicine, I think slowly I start fall in love with this field, dealing with the sick patient. I think the hope we can give to them. It's just the patient like in treating them and make them happy, and at least it's not like cancer in 100% equals to death. So there's some hope, and there's a lot of a newer treatment that we can offer for our patients. Yeah.
Lovely, doctor. And so you've been in adult hematology and your kind of journey. Would you like to tell us a little bit about how you've traversed through this entire kind of journey to become a consultant hematologist?
I see. So I think it's quite a long journey. I think already be with University Malaya for at least 14 years. Start off with my master in internal medicine journey, and then later start specialize another 3 to 4 years lah, doing a hematology training, and then we need to sit for exam, special exam, to be gazetted as a consultant in hematology. Yeah.
Oh, lovely, doctor. And so you've entirely been in University Malaya.
Uh, Kind of lah. I think almost. Yeah.
Nice, nice, lovely, doctor. And how different is it, or how challenging is it to be in one of these academic centers where I'm sure you all get the most challenging cases? Has it been fun? Has it been very exhausting?
I think when we do what we love, uh, we kind of to, I mean, like when we do what we love, I think whatever the problem, we tend to, how to say, we tend to enjoy. I mean, like, I think nothing that we can't overcome. Yeah. Of course, it's challenging. I think being the university, we are not just a clinician, we are also a researcher, academician, and many more tasks, other tasks. Yeah.
Right. Lovely, Doc. So this evening, Doc, you're going to speak to us about lymphomas, and so we're going to turn the stage over to you as you share with us a little bit about lymphomas. And ladies and gentlemen, if you're just tuning in, we have Dr. Adila this evening, who's a consultant hematologist and physician, and Dr. Adila is going to be taking note and actually getting us to take note of lymphomas. So without further ado, Doctor, the session over to you.
Thank you. Thank you to Dr. Murali Taram, Managing Director of National Cancer Society Malaysia, for your kind introduction. Thank you, National Cancer Society Malaysia, for inviting me, and I am really grateful to be here tonight in conjunction of International World Lymphoma Day. I would like also to thanks to all audience, lymphoma fighters all over Malaysia. So what is lymphoma? Lymphoma is a cancer of the lymphatic system. There are two main types of lymphoma, which are Hodgkin lymphoma and non-Hodgkin lymphoma. Lymphoma accounts for approximately 55% of the blood cancers. It is the sixth most common cancer in Malaysia. Lymphoma is most often diagnosed in a people aged between 15 to 35 years old and over the age of 50 years old. Lymphoma is cancer that begins in infection-fighting cells of the immune system called lymphocyte. These cells are usually located in the lymph nodes, spleen, thymus, bone marrow, and other parts of the body. In patients with lymphoma, the lymphocytes are mutated and grow out of control. Let's go lymphoma by numbers. According to American Society of Clinical Oncology, there are 70 number of lymphoma subtypes, which includes both Hodgkin lymphoma and non-Hodgkin lymphoma. Hodgkin lymphoma is often diagnosed at the age of 20 to 30 years old. 82,000 number of Americans diagnosed every year. The 5-year survival rate of Hodgkin lymphoma is 87%, and the 5-year overall survival rate for non-Hodgkin lymphoma is 71%. To begin, let's look at one of the lymphoma study in Malaysia. In this study, we report a single institutional data of patients with lymphoma in Malaysia from University Malaya Medical Center. We obtained the data of patients diagnosed with lymphoma treated by adult hematology unit between 1996 and 2018 from hospital electronic medical records. As we know, the subdistribution of lymphoma reveals diverse geography and ethnic variation. There is limited information available in regards to the epidemiology distribution and survival outcome of lymphoma in Southeast Asia regions. As I mentioned earlier, there are two main subtypes of lymphoma, which are Hodgkin and non-Hodgkin lymphoma. In our study, 84.7% were non-Hodgkin lymphoma and 15.3% were Hodgkin lymphoma. For non-Hodgkin lymphomas, B cells are more common than T cells, which represent 72.5% of overall data for non-Hodgkin lymphoma. B cell lymphoma can arise at any stage of normal B cell development. Diffuse large B cell lymphomas and aggressive types of lymphoma accounts around 71% of B cell subtypes category, followed by follicular lymphoma and indolent B cell lymphoma. T and NK cell lymphomas can arise at any stage of normal T or NK cell development. For cases in which this distinction is unclear, the term NKT cell non-Hodgkin lymphoma is used. And the highest recorded in our study was T cell unspecified, which consists of 30.2%. The histopathological subtypes of non-Hodgkin lymphoma in Malaysia is similar to features noted throughout Asia and United States of America, whereby the most common was diffuse large B-cell lymphoma and aggressive lymphoma, followed by follicular lymphoma. In comparison, Malaysia has the highest incident rate of diffuse large B-cell lymphoma in Asia. This finding of the highest incident rate of diffuse large B-cell lymphoma in Malaysia corresponds to the study done 2 decades ago. Hodgkin lymphoma has been reported to be rare in Asians. However, we reported a higher prevalence, 15.3%, compared to USA and Japan. So the subtypes of lymphoma in Malaysia are similar to what was reported in Asia regions, where Hodgkin lymphoma remains relatively uncommon when compared to the Western population. The frequency of follicular lymphoma is uncommon, and T-cell lymphoma is comparable to what was reported in other Western countries. Compared to other Asian countries, it appeared that the prevalence of diffuse large B-cell lymphoma and Hodgkin lymphoma in Malaysia is higher. The major cause of death in this study remain as disease-related. Now, our next topic is facts and myths about lymphoma. I think this is the favorite question given by our patients and our caregiver. We try to cover as many questions as I can, and I think the rest of it we can keep it at the question and answer session. So point number 1, what are the common symptoms of lymphoma? The most common symptoms reported by Lymphoma Research Foundation include fever. It's usually high temperature that come and go with no obvious cause, usually at night. Fatigue, unintentional weight loss over a short period of time, heavy sweating, especially at night, chills, shortness of breath, chest pain or pressure over the chest, lack of energy, swollen lymph nodes, often painless, swollen, easy bruising and bleeding, usually if the lymphoma affect the bone marrow, which can reduce our platelet counts, frequent infection, and other possible symptoms that may arise depending which areas are affected. Swollen lymph nodes can press on the nerve and cause pain, cause swelling in the arms or legs by blocking the flow of lymphatic fluid around the body, cause yellowing of the skin and eyes, which we call jaundice, by blocking the flow of bile from the liver. The above are not common, but they can happen. Fact number 2, what increases my risk of getting lymphoma? According to the American Cancer Society, several risk factors have been associated with Hodgkin lymphoma, but the reasons are unknown. Let's go one by one. Age. Although non-Hodgkin lymphoma can happen at any age, most cases, 60%, are diagnosed in people aged 65 and over. Overall, non-Hodgkin lymphoma is slightly more common in men than women. Hodgkin lymphoma occurs most often in early adulthood between age 15 to 40 and especially in the 20s. Let's move on to the next point about weakened immune system. People whose immune system are compromised are more likely to develop lymphoma. The immune system can be adversely affected by taking drugs to stop organ rejection after a transplant, contracting HIV or AIDS, being born with rare medical condition that affects immunity, or having any autoimmune diseases. How about infection? There have been some infection that have been recorded to increase the risk of lymphoma. namely 1. T-cell lymphoma virus 1, which we call HTLV1, Epstein-Barr virus that causes the infectious mononucleosis, and Helicobacter pylori. Next is a family history. Having a parent, brother, or sister diagnosed with non-Hodgkin lymphoma slightly increases your risk. The general risk is, however, still very small. And last but not least, previous cancer and treatment. Some other types of cancer and treatment may also increase your risk of non-Hodgkin lymphoma. You might also be at higher risk if you had melanoma. So fact number 3, how lymphoma is diagnosed. Diagnostic tools start with a physical examination, where your doctor will check for enlarged lymph nodes in your neck, underarms, and groin. A biopsy of lymph nodes or bone marrow must be performed in order to obtain tissue or cells, which are sent for various tests to determine if lymphoma cells are present, and if so, what types. Selection of lymph nodes to biopsy depends on the clinical situation and the location of involved site or involved nodes. A lymph node should be considered for biopsy if one or more of the following lymph node characteristic is present. Firstly, significant enlargement. In general, lymph nodes more than 2.5 meters square, a node that bipendicular diameters of 1.5 times 1.5 cm or 2 cm in a single diameter have the best diagnostic yields, whereas lymph node less than 1 cm diameter are unlikely to provide any specific diagnosis. Next, persistent for more than 4 to 6 weeks or progressively increasing in size. Additional diagnostic tests, including imaging, for example, chest X-ray, CT scan, MRI, PET scan, and ultrasound, or endoscopic procedures, for example, bronchoscopy, colonoscopy, and cystoscopy, might need to be performed. So fact number 4, how do we stage lymphoma? Stage 1, one lymph node area is affected. This is either above or below the diaphragm. Stage 2, 2 or more lymph node areas are affected on the same side of the diaphragm. Stage 3, lymph nodes areas both above and diaphragm are affected. Stage 4, lymphoma is in multiple lymph nodes and has spread to other parts of the body, for example, bone marrow, liver, and lung. So fact number 5, how do we grade lymphoma? There are 4 grades of lymphoma. Grade number 1, the cell looks normal and tend to be slow growing. Grade 2, most intermediate lymphoma are treated as aggressive, even though they grow less rapidly. Some of these types are curable. And grade 3 and 4, these cells grow very rapidly and require a more aggressive therapy approach. For example, diffuse large B-cell lymphoma and Burkitt's lymphoma. So next question, is lymphoma curable? An individual's prognosis after a lymphoma diagnosis depends on the stage and type of lymphoma. Many types of lymphoma are treatable and highly curable. However, not all are curable. Some types of lymphoma are also slow-growing or indolent. In this case, treatment may not be needed because of the prognosis still good. The earlier the lymphoma is treated, the higher the chance of recovery. So next, what are the treatment options for lymphoma? Treatment will depend on the type and stage of lymphoma. Hodgkin lymphoma is often treated with chemotherapy. Example, EBVD, which consists of doxorubicin, bleomycin, vinblastine, and dacarbazine. Radiation therapy, where high energy rays destroy cancer cells. Immunotherapy, which uses monoclonal antibodies to target a specific protein on the cancer cell, as well as stem cell transplantation. Surgery is rarely used to treat Hodgkin lymphoma, except for biopsy and staging. Again, treatment will depend on the type and stage of lymphoma. There are several ways to treat lymphoma. For example, chemotherapy, radiation therapy, surgery, and immunotherapy. Often, the mainstay treatment for lymphoma is chemotherapy, which is proven to be effective and safe. Although it's known that chemotherapy may harm normal healthy cells and cause side effects such as hair loss, they're often short-term and not serious. Most patients have a normal, healthy, recovered body after chemotherapy. Immunotherapy is a form of cancer treatment that deploys the human immune system to fight cancer cells. It allows the attack of cancer cells without harming any cells in the body, thus cause minimal side effect. Immunotherapy can be used alone in the body of cancer or combined with chemotherapy. Other type of immunotherapy is checkpoint inhibitor. Checkpoint inhibitors are also described as a type of monoclonal antibody or targeted treatment. They activate the immune system to recognize and attack cancer cells. Other types of immunotherapy is the chimeric antigen receptor, CAR T cell therapy, where the patient's lymphocyte called T cells are harvested and modified to equip them with the ability to attack the cancer cell. So let's go on to the myth. Point number 1, a diagnosis of lymphoma is a death sentence. No, this is not true. According to Leukemia and Lymphoma Society, 5-year survival rate for Hodgkin lymphoma is 88%, double than survival rate 50 years ago. Please remember, I am fighting, I am living, and I am winning. Many of Hodgkin lymphoma are able to go on and lead to active life after being cured. Although the survival rate for non-Hodgkin lymphoma is lower than Hodgkin lymphoma, the 5-year overall survival rate is still estimated around 70%. There are different systems to evaluate the prognosis of the lymphoma cancer. Treatment and outcomes of the lymphoma have improved significantly in recent years with the understanding of the genetic changes using cutting-edge technology and the availability of new targeted treatments, and a fewer side effects with targeted treatments and protocols. Myth number 2, patients who are diagnosed with Hodgkin lymphoma are lucky compared to those diagnosed with non-Hodgkin lymphoma. This is not true. The fact is those given with the diagnosis of Hodgkin lymphoma do not all survive, and those with non-Hodgkin lymphoma may be very well beat the disease. Hodgkin lymphoma may be curable, but that doesn't mean it will be an easy fight. Over the past couple decades, the survival rate for various types of lymphoma have been increasing due to the advancement in the research and new treatment options. While survival rates are based on the aggregate data from a large group of people, each individual case is different. The prognosis for any individual with blood cancer is based on many factors, including the type of the lymphoma they have, how it responds to treatment, and their overall health before the treatment and throughout the treatment. Myth number 3, non-Hodgkin lymphoma refers to one specific type of lymphoma. If you listen to my talk carefully, I already mentioned that non-Hodgkin lymphoma has more than 60 or more than 70 subtypes and more common than Hodgkin lymphoma. So it's not just belong to one or refer to one specific type of lymphoma. Next point, sugar feeds cancer cells, and eliminating sugar from your diet can help cure cancer. Is this true? No, this is not true. Research has not shown that a diet in high sugar directly causes cancer. Eating a diet higher in sugar does tend to lead to obesity, which has been linked to higher risk of developing certain cancer. But removing sugar from the diet has not been proven to improve survival of cancer. So myth number 5, all lymphoma cancer patients need bone marrow transplant. This is not true. For most of the patients with lymphoma, most of them do not require transplant in frontline setting. Myth number 6, there is screening test for lymphoma. This is not true. There is no screening test for lymphoma. The goal of a screening test is to check for the presence of the certain disease in someone who is not experiencing any symptoms. Currently, there is no standardized Hodgkin and non-Hodgkin lymphoma screening test for individuals who are not already experiencing symptoms. Doctors or physicians can identify certain individuals who might have higher risk of developing this form of cancer, but there is not yet an effective way to detect Hodgkin and non-Hodgkin lymphoma if a physician does not have a reason to believe it might be present. So the answer is no. So enough with the facts and myths. Let's move on to understanding the lymphoma patient journey. Lymphoma is not all about the treatment, diagnosis, patient and family survivorship, financial effect, support group. To all lymphoma patients and caregiver, please know that we are in this together. We are one family. Thank you so much for giving us the opportunity to support you during this rough time. I am honored that I have the opportunity to witness your strength, even though I wish you weren't going through this scary season. Thank you so much for the example that you set each and every day. These are the acknowledgements. Without further delay, I would like to invite this lovely motivated lady, Miss Nur Azlizan binti Saniman. She was diagnosed with diffuse large B-cell lymphoma stage 3B. She underwent multiple lines of chemotherapy, for example, CHOP, hypercivec block A and B, DHEP, VP16, and latest proceeded with autologous stem cell transplantation. What a long journey for her. Currently, she's a lymphoma cancer survivor for the past 17 years, and I think already discharged from the follow-up from hospital Johor Bahru. Let's welcome her. Hello, hi Azlizan.
Hi Dr. Dila.
Thank you for being with us tonight. Okay, shall we start? Would you like to introduce yourself more? Can you tell me more about yourself? And yeah.
Okay, first of all, I would like to thank National Cancer Society Malaysia, to Dr. Adila, Dr. Murali, and also want to thank to my adik, my tulang belakang in Lymphoma Fighter family, Mr. Muhammad Nur Akmal. Okay, hi, good evening everyone. I'm Nur Azlizan binti Saniman. I'm 42 years old. I'm self-employed and from Johor Bahru. I play a leading role in Lymphoma Fighter family Malaysia. And I was diagnosed with diffuse large B-cell lymphoma, stage 3B in 2003. And now it's been 17 years I've been surviving and with no relapse.
Can you tell me more about the symptoms that you had experienced before the diagnosis of lymphoma? What are the symptoms? Yeah.
It was a common symptom that I had before, which were, firstly, I had pain on my shoulder. Then I can't breathe very well. Then my late father brought me to the clinic. Then the doctor only suspected me to have asthma. I was given some specific medicine, but there were no changes. And at the same time, I keep on coughing, fever on and off, lost appetite, losing weight. There were rashes, and finally I was fainted. And again, my late father brought me to the emergency. So that was the beginning of the journey. Then during the time I was at the hospital, I did an X-ray, and the result showed that my left lung was blank. It showed nothing, all white. So the doctor said there were fluid in my lungs. So they decided to do a chest tube, and yet still the same. Then I went to run a CT scan. So the result showed that I got 50 centimeter mass in my left lung. The process keeps on going until the biopsy and the other stuff has ended. I got the final result that I got cancer. Then when the doctor said it was a cancer, I be like, oh, okay, and still keep calm and just thought that it's the same as fever. It will get better soon. So that just it. So for my experience before I was diagnosed cancer.
Can you tell us more about the treatment that you underwent throughout? Yeah.
As for the treatment, I had received chemotherapy, and I did a bone marrow transplant as well. I had about 11 cycles of chemotherapy, which along the cycle I had common side effect that I think most of the people that running a chemotherapy felt the same way. The side effect were I had a fever, vomit, full acid in my mouth, headache, I lost my hair, lost appetite, tiredness as well.
Who actually, how do you overcome that tiredness or the side effect of chemotherapy? What did you do during that time?
Just rest and never take any supplement.
That's good. How about the family support, the friend support, the peer support? Yeah.
A lot. Family, my late father, my siblings, and my old friends always support me.
That's wonderful. So, Ms. Azizan, last but not least, what is your hope and advice to others, other lymphoma fighters, your friend that newly diagnosed?
Okay, my advice to other is that whoever that just diagnosed cancer, please do an immediate action such as get the treatment. Please do follow and listen to whatever the doctor will suggest to you and plan to you because they know very well and will do the best to help you get better and cure. So do not afraid to get the treatment. For all cancer fighter out there, keep on fighting, stay positive, and do accept all the possibilities wholeheartedly.
Anything more you want to say when Ms. Azizan? It has been a very, very long journey for you. Yeah.
Smile and let everyone know that today you are a lot stronger than you were yesterday. To all fighters, keep up your fight. Strength does not come from physical ability, but it does come from a spirit that is not easily defeated. Hashtag strong together.
Thank you so much for the sharing. Thank you for being with us tonight. invited her actually at a very last minute, and she's willing to be here tonight to share with us her long journey with diffuse large B-cell lymphoma. It's one of the most common and aggressive type of lymphoma that have been diagnosed so far. Thank you once again, Puan Azizan.
Thank you, Doctor.
Thanks so much, Puan Azlizan, and of course, Dr. Adila as well. That was such a very inspiring and really heartwarming session, Doctor. So a couple of questions that have come up. I think both, I think for Puan Azlizan and Dr. Adila as well. Puan Azlizan, if you don't mind, we can all switch on our cameras, Puan, and we can take the questions together. Some I think are quite medically technical questions. Okay, so I'm going to put them to Dr. Adila first, but I'm sure there's some of the questions which are for Puan as well. And this one I think is for Doctor lah. Doctor, ALL, between these four types, this ALL, AML, CLL, and CML, which is the more prevalent in Malaysia in terms of adults, kids? Which one is I think a very common kind of question on what's the prevalence like, Doctor?
Okay, actually, the question ALL, AML is all actually fall under leukemia group. Actually, it's not lymphoma, so it's out of our topic tonight. But in general, AML is more common in adult, and ALL more common actually in a younger age group, in the pediatric age group.
Right, got it, Doctor. There's another question, Doctor, on could you explain about rectal chemotherapy for those who can't tolerate pain from usual chemotherapy? This is really quite a highly specific question, Doctor.
Rectal chemotherapy.
Uh-huh.
So far, actually, I have not I can't really answer that question clearly because that's not actually the standard way of chemotherapy in any international guideline.
Right.
So we have not practicing as such at all for our hematology malignancy. Yeah.
Right. In terms of
but if the rectal, for example, the pain control like a radiation, yes, I think, but not like really like a
chemotherapy per se lah. Okay, Doctor, this is kind of actually the question that I'm putting forward, and this is really on. I see, like Doctor, like Puan was telling us about her experience, Doctor. So let's say generally in Malaysia, as a common person, what would happen is you start showing some signs and symptoms, and generally you end up either going to the clinic kesihatan or to your GP. At what point, and because a lot of these symptoms are very vague and non-specific, at what point do you think, Doctor, that as a patient you should start getting a little bit concerned and want to step up, like to go and see a specialist in terms of picking up a lymphoma?
Okay, so I think because the problem about cancer, in any cancer, most in general usually is become painless. So usually patient don't come early because it's no pain. So once the cancer start, the patient start experiencing pain, for example, when the cancer invading in certain tissue or nerve, that's usually is quite advanced stage already. So my say is when you notice anything abnormal, like for example, even it's just a painless swelling, please seek a medical advice so that we can lead you accordingly. Yeah.
Okay. Well, do, Doctor. And in terms of, when we're speaking about this painless nodes, right, in the context of lymphoma, a lot of people in Malaysia often kind of just brush this off with lipomas, which actually you see quite a bit of within the population, Doctor. Any kind of tips, Doctor, for people to kind of differentiate between a lipoma that crops up or when it might be something a little more suspicious?
I see. Okay, I think that question, again, lymphoma can be a very, very slow growing. Maybe can be like behave like mistaken whether it's lipoma or lymphoma. But some lymphoma can grow very rapidly. And I'm sure the one that grow rapidly, usually patient will seek early medical attention. Okay, because it's something wrong when something grow rapidly somewhere. So for me, I think anything that unusual, not sure, even if you don't see a hematologist, I think you should just go and see present at the clinic kesihatan or any GP, so that we can take a thorough history and also do a physical examination to see whether any suspicion sign that warrant further investigation. Yeah.
Right. Lovely, Doctor. I've got just one more question before I just kind of have a series of questions for Puan Razlizan. And this one really, I think, thank you. By the way, I just wanted to interrupt and say thank you so much for putting up all these myths about lymphomas and, trying really to share about a lot of these common misconceptions a lot of people have. While we're on that note, Doctor, I really need to ask you this one because it crops up so many times, and I hope you'll be able to also kind of add kind of value to this. There's a common myth that you should not biopsy all these cancers, or if you biopsy the lymph node, the cancer will then spread along the hematogenous route and go along everywhere. Is this true, Doctor?
No, definitely that's not true.
Yeah,
I
lovely.
think even lymphoma, I think warrant a very, very good excisional lymph node biopsy, because when we don't do a proper excisional biopsy, we didn't take out the whole lymph nodes. Sometimes we may wrongly diagnose with other things, like for example, we had like common cases sometimes being referred to us based on FNEC result, meaning just take the sample from the tissue, or we call it true cut biopsy.
Okay.
So only like a specific portion of that tissue being seen. So the diagnosis is totally different. So initially the patient was diagnosed with very aggressive lymphoma, which are quite poor prognosis as such. But when we repeated the biopsy was done with a proper excisional biopsy, it's just a benign and self-limiting disease.
Oh, dear.
So
Okay.
a proper biopsy, I would say, is very important, because it may be a lot of different. And I think we don't have many lymphoma histopathology experts in Malaysia. So not just to get the tissue, but to read and to get a proper diagnosis is very important before we initiated any treatment. Yeah.
Okay.
Doktor,
Yes, Puan.
Doktor, sorry Doktor Dila, soalan ni selalu ditanya dalam grup dan siapa-siapa je lah yang mula diagnose tau. Adakah rawatan transplant autologous dan allogeneic memberi jaminan untuk 100% sembuh? Berapa peratus keberjayaan rawatan tersebut?
Okay. Dr. Morelli, maybe I can answer in both language, like BM and also Bahasa.
No problem, Doctor. Feel free.
So I think as what I mentioned just now, not all lymphoma require a stem cell transplant. Maknanya bukan semua lymphoma kita perlu menjalani pemindahan susun tulang. So macam case Azlizan just now, in your case, Azlizan, saya tengok kemoterapi yang Azlizan lalui banyak. It's not just a first line. Selalunya, in general, lymphoma yang respond to satu line of chemotherapy tidak perlu menjalani pemindahan susun tulang. Usually, lymphoma that needed bone marrow transplant is the one that relapsed, meaning you cure and relapse, or refractory, difficult to go, or have all the bad molecular markers like a triple hit, double espresso, or transform from a slow, like marginal zone lymphoma, transform to aggressive lymphoma. So this kind of lymphoma usually need a stem cell transplantation. Okay, so kebarangkalian untuk sembuh, I think there's no such thing as 100%. Okay, I think mana-mana doktor pun dalam rawatan kita tak boleh cakap 100%. Tapi bila once the pakar sudah mencadangkan pesakit untuk menjalani pemindahan susun tulang, sebenarnya ada sebab yang kuat kenapa pesakit perlu menjalani pemindahan susun tulang. So selalunya bila kita compare dalam situasi tersebut, kita compare dua grup, pesakit yang tidak menjalani dan menjalani. Okay, bila pesakit tu harus menjalani pemindahan susun tulang dan tidak menjalani, so kita panggil overall survival dalam kanser. So jangka hayat berdasarkan kajian banyak dijalankan, jangka hayat hidup tu lagi pendek lah. Okay, lagi pendek disebabkan oleh penyakit itu sendiri compare dengan pesakit yang menjalani pemindahan susun tulang. Usually in stem cell transplantation, we give a high dose chemotherapy. So it can kill the remaining cancer that can even be picked up by the scan, even our PET scan. So with that, I think we can induce remission for a longer before a relapse happen. Yeah.
Okay.
Jawab ke soalan Azlizan tu? I
Jawab.
think it's a case by case basis.
Okay.
And ada lagi satu soalan, boleh?
Boleh teruskan je Puan.
Okay. Penggunaan ubat seperti brentuximab dan
Pembrolizumab.
dalam rawatan kanser limfoma menjadi harapan baru untuk seseorang pesakit itu survive. Adakah ianya membantu dalam rawatan dan apakah kesan sampingan penggunaan ubat tersebut?
Brentuximab. Okay, so I think in general, usually all the in 90s, I think we don't have much of this option of the targeted therapy. Maknanya the treatment only targeted is modified to target the certain certain there's a markers to target and destroy the cancer cells. So usually the side effect is quite minimal in comparison to just a high dose chemotherapy alone. But based on ongoing study, I think the mainstay right now is the chemotherapy. But with the combination, it's certainly, I won't go one by one because I think again lymphoma ada banyak subtypes, too many subtypes. So with the combination of chemotherapy plus targeted therapy, usually can induce the remission longer and giving a promise overall survival. So jangka hayat pun selalunya lagi lama dan kesan lagi baik. Side effect untuk setiap chemoterapi also targeted therapy selalunya pesakit mengalami brentuximab kebanyakan lah. I think what I observe most of patients sometimes complain of rash type of ni. But most in general chemotherapy usually the side effect more to cytopenia. If you have neutropenia, usually you are prone to get infection. If your platelet drop, you can prone to have bleeding or anemia as such. So I think it's depending on what type of lymphoma that you've been treating during that time. So side effect can differ actually because some patients have no side effect at all. Yeah.
Got another question. Will people with early stage lymphoma present normal blood tests?
Yes. So most of the lymphoma, most of the patient, even sometimes a patient with stage 4, we have a normal full blood count. Okay. So usually patient with lymphoma with bone marrow involvement. So once you disturb your factory of the blood production, that is when patient presented with abnormal full blood count. Maknanya darah merah boleh rendah, platelet boleh rendah, and darah putih pun boleh rendah. Or if patient, for example, if patient have a gut lymphoma, maknanya lymphoma dalam perut and have an internal bleeding or gut bleeding, tu pun boleh menyebabkan abnormal full blood count. So in general, usually most of the patient can usually presented with a normal full blood count. Boleh. Bukannya tunggu full blood count yang normal baru lymphoma, no. Yeah.
Okay, and I think there's one which I think one so may have asked about it. Whether doctor, is that how is T cell histiocyte rich B cell lymphoma different than DLBCL?
Sorry.
So there's a question
I think in general for non-Hodgkin lymphoma, there's two major in general in a big group. We divide into B cell and T cell. And B cell usually consists of 70 to 80%. T cell usually less than 10%. Okay, under B cell there's many subtypes, and under T cell there's many other subtypes. But B cell, as what we can see, is the commonest and the most common subtypes based on the study done at our center, and we compare with other countries at the Southeast Asia region like Thailand, Japan, and also we compare with the other Western countries. The commonest, most of the report is the highest actually diffuse large B-cell lymphoma. And we know diffuse large B-cell lymphoma is one of the most aggressive lymphoma.
Okay.
The treatment differed. So when we see B, we targeted again the B cell.
Got it.
And yeah.
Well, Doc. Doc, there's another question and quite a bit of a general one. There's fatigue that does not subside after a night's sleep for many, many months. Is this something to be concerned about?
I think Dr. Murali also know fatigue is very very subjective lah. Many diseases can presented with fatigue, for example. So, but if you think the patient thinks it's something abnormal, because sometimes when you are newly diagnosed diabetes, also you can present it with fatigue, and any other diseases, not just diabetes or cancer per se. So I recommend that anyone that experience anything abnormal in your body, just get a medical checkup and go and see your nearby doctor for us to get more detailed history, and we can do further physical examination and maybe warrant a blood test if indicated. Yeah.
Okay. Got it, Doc. One, actually, a couple of questions for yourself, and perhaps this might be helpful for fellow lymphoma patients and colleagues out there. What was like the most challenging thing that you had to face during your entire treatment journey, and how did you overcome it?
Very challenging. On my second chemo, I think that my mouth have burst with ulcer. 2 weeks I can't eat, just all use drip. And semangat lah, dari family, kawan-kawan, diorang yang bagi semangat. Then I keep on going with doctor plans and all that.
Ada tak terasa macam sometimes aku tak nak lah chemoterapi ni, tak pernah ada
Sebab when the doctor said chemo, then I just okay, chemo ni macam demam lah, besok baik, macam tu. Memang tak pernah rasa down sebab macam fikir okay aku kena cancer. Okay, cancer, macam tu je lah.
Okay. Apa macam Puan kata tadi, you family is a motivation, friends, but for you, like what is your macam the most primary source of motivation lah? Siapa yang paling kuat memberi inspirasi ke, atau like apa yang memberikan inspirasi itu kepada Puan?
Okay, I dah tak ada mak since I umur 14 tahun. Then I ada only my father. Now dia pun dah pass away. And that time dia memang sangat-sangat lah memberi. Tengok kekuatan semangat dia tu. Jadi dapat semangat tu daripada dia lah, dan adik-beradik lah. Memang dia lah yang memang dia senang. Dia punya orang memang senang. Apa doktor plan, okay, dia cakap jalan je. Janji dia sihat. Dia pun tak pernah masa doktor bagi tahu saya cancer pun dia cuma okay, doktor apa plan untuk dia, and then doktor buatlah. Janji dia sihat. Masa transplant pun macam tu, doktor terangkan, and then dia pun cakap benda yang sama. Buatlah, janji dia sihat. Ikut je, dia kata. Ikut je apa doktor nak buat, okay doktor buat. Dia tak pernah lah tunjuk yang dia sedih ke. Tapi I tak tahulah kalau belakang I. Tapi memang dia tak pernah. Dia datang hospital pun okay, dia tengok I macam tu. Kalau I macam tak larat atau apa, dia akan cakap tidur, bangun tidur okay, mesti baik, dia cakap macam tu. So sampai sekarang lah kalau sakit kepala ke apa pun tidur dia. Memang itu pesanan dia, tidur dia kata.
Okay. Doc, a couple of questions as we kind of close out the loop for the session this evening, Doc. I think you answered one on this, but there is another question, and on a very similar note. How do doctors usually identify early stage lymphoma patients since their blood count is normal?
So I think it's a normal routine. Once we suspect that patient has a lymphoma, so we refer the patient for a additional lymph node biopsy. Okay. So after that, we need to stage the patient via whether we do a CT scan, CT staging, start from neck, abdomen, thorax, and pelvis, or we do a PET scan. So I think from there we can decide whether this patient is early stage and so on. I think all lymphoma warrant a staging scan. Yeah.
Absolutely. Lovely, lovely, Doc. Thanks so much. And there's a nice question here on how does one actually put up to donate their bone marrow?
I see. So I think we have a bone marrow registry in Malaysia. I think we
Mhm.
just can Google, because I think our awareness about the the stem cell donation in Malaysia, I think not so great in comparison to overseas.
Mhm.
So I think the awareness is increasing now, especially Ampang Hospital, our government set up for our hematology in Malaysia, the Ampang. I think every year they run a campaign about this, about the stem cell donation. I think otherwise, I think we can Google at the website, go to the stem cell registry Malaysia, or I think when we Google something, we come out there. I think they will let us know how to become the donor for the stem cell. Yeah.
Doktor,
Ya, ya Puan.
ada yang tanya juga ni, pesakit yang menggunakan stem cell adik-beradik,
Mhm.
mereka bagi rawatan allogeneic transplant, ada risiko yang sangat tinggi ke, fakta atau mitos?
Okay. So I think the best stem cell, if patient need to, meaning usually if patient fail autologous stem cell transplant, so usually we subject, and the lymphoma relapse, or for any reason we need to subject the patient for allogeneic stem cell transplant, meaning not your own stem cell. So the best actually is getting from your own siblings. But based on the study done, even we have like 8, 9 siblings, the chances of getting matched sibling, usually we based on our HLA antigen, usually it's around just 20 to 30%. So I think that's the best, one of the best way to go for allogeneic stem cell transplant. I think one of the lowest, because let's say if you don't have a suitable donor among your siblings, okay, there's another 2 options to go. One of it we call match unrelated stem cell transplantation. So we activate the local Malaysia registry and overseas registry to find the most suitable match for your HLA antigen. But I think that one is a bit tedious, take a lot of work, because we need to bring and import, the stem cell from overseas and search for the donor and such. And usually the cost is quite high. But nowadays, I think as most of the diseases can't wait for that process, and I think because of the financial constraint, so in Malaysia itself, we've been doing a lot of haploidentical transplant, meaning half match je adik-beradik. Usually adik-beradik sebab you receive the DNA or gene HLA from your mother and your father. So very hard to find a full match lah, okay? So but that doesn't mean that you cannot proceed with the stem cell transplantation. Stem cell transplantation can be done, but that one usually is more higher risk than you getting your match. Maknanya adik-beradik yang betul-betul match 100%. Maknanya adik-beradik yang tak match, ataupun ayah atau mak yang tak match, dia akan separuh match antaranya tu, boleh jadi donor. Tapi selalunya risiko tu lagi tinggi. Sebab kita kena guna banyak ubat yang lagi kuat untuk prevent rejection and acute graft versus host disease. Sebab body kita rasa tu bukan stem cell kita, so dia akan attack. So penggunaan ubat selalunya lagi kuat dalam separuh match transplant compared to full match siblings. Yeah. Sorry, apa tu? Azliza, I answer in general. Yeah.
No, my kakak in life.
Okay. And and there's one question. I think maybe this might be good for both Puan and for doctor as well. After you've completed treatment, what are like diet or actions that should be taken to avoid or reduce the risk of relapse or recurrent?
Apa?
I think usually after treatment, and when the patient out of the neutropenic period, meaning the white cell come back to normal, I think you can take any diet that you want actually, any normal healthy diet. I mean, usually during the period of chemotherapy, and if a patient has a prolonged neutropenia, usually we ask patient to avoid all the half-cooked food, half-boiled egg, sushi, all the raw food. And if they want to eat fruit, we ask them to peel off the skin. and usually vegetables, no salad. They need to full cook their food. But for survivor, actually, you can go on to enjoy whatever I think the food that you want to eat actually. I mean, like on off, I think you still can take your McDonald's or KFC if you want to. But what I say is just a normal healthy diet, meaning what has been recommended in general for even a normal people, not just vegetarian. So I think you can go on with whatever you want. Yeah. As Lizan, any other advice usually what usually you do after the period of the post chemotherapy and so on?
Apa? Masa
Makanan, Azizan ada pantang apa-apa ke?
untuk 5 tahun yang pertama tu saya memang avoid seafood. Tapi siapa boleh makan makanlah, saya tak. Tapi saya lah. Saya avoid seafood, makanan dalam tin. Macam apa? Macam
All the processed food lah. I think
yeah.
avoiding all the processed food. Yeah.
But now dah boleh makan lah. Tak ada apa.
Yeah.
Okay. So, Doc, as we wrap up the session, first, of course, again from the National Cancer Society of Malaysia, we'd really like to thank you and Puan Nur Azlizan for taking the time to be with us today and sharing sedikit sebanyak lah, on lymphoma in conjunction with World Lymphoma kind of remembrance which is going on during this period. Just as we wrap up the session, could I kindly ask you maybe, Doc, to leave us with some maybe kata-kata hikmah, and then of course Puan Azlizan as well for all our viewers tonight.
I think when you have any doubt, talk to your doctor so that we can try to help you out. Don't keep it alone. Don't don't refer to Google. Don't refer to don't do. Sometimes they tend to listen to their family members. I mean, get the proper advice from your hematologist or your doctor to guide you. I mean, like, don't, because a lot of our patients like to, people even, I mean, like, they like to go to all this alternative medicine, Ayurvedic medicine, a lot, and many more. I think very difficult to mention all that. But I think please follow the doctor's advice, listen to what we recommend you to do, because whatever treatment that we start has been established, has been ongoing many studies. So we don't just simply do things that may harm you, but actually we just want to help you. So don't scared to ask doctor's question, and we are here for you lah. Yeah.
Absolutely, Doc. And Puan, maybe some sharing or insights from you as well, Puan, as we close the session.
Kalau rasa diri tu down, kita cari satu kelompok support group. Macam kami dekat Lymphoma Fighter Family, dan macam family lah. Memang apa je masalah boleh tanya sama ada yang senior atau yang pernah alami apa semua. So jangan pernah rasa diri tu sorang-sorang, macam doktor cakap tadi lah. Jangan pernah rasa down. Down tu boleh, tapi jangan terlalu emosi sampai rasa macam tak boleh baik, tak boleh sihat. Jangan takut untuk kemo. Sebab kebanyakan yang saya nampak semua takut untuk kemo. Sebab takut untuk dia punya side effect dia tu. Jangan takut, ikut plan doktor. Apa yang doktor cakap tu ikut plan doktor. Sebab doktor lagi tahulah apa yang untuk diri kita kan.
Right. And maybe on those words, ladies and gentlemen, please let us thank again Dr. Adila and Puan Nur Azlizan for joining us today, and our partners for this session, University Malaya Medical Center, and our sponsor for this series, Roche Diagnostics, Shared Services, and Pharmaceuticals. Thank you so much, and we'll see you all again soon. Good night, and have a wonderful week ahead.
Yeah. Thank
Selamat
you.
Hari Malaysia.
Yeah, Selamat Hari Malaysia, everyone.
Thank you, Doctor.